Sudden cardiac arrest can happen at any time. Immediate defibrillation and effective CPR can improve someone's chances of survival by up to 70%. Using a Mediana A16 AED is easier than you might think. It can be used by any bystander, even without training. Look out for any possible danger that could affect you, your casualty, or passers-by, and then try and wake the person. And if they do not respond, call 999 or 112 from your mobile. Then shout for the Mediana A16 AED. If the casualty is at risk of further injury or in contact from water, carefully move them to the nearest safe and dry place. Remember, stay away from anything wet when delivering shocks, as water conducts electricity. You need to start performing the ABCs as quickly as possible: airway, breathing, and circulation. When a person is unconscious, their muscles relax, so their tongue can block their airway. After looking into their mouth to make sure the passage is clear, tilt their head back to open the airway. Next, with your head by their face, look to see if their chest is moving and feel for breathing on your cheek. Do this for no more than 10 seconds. If the person isn't breathing, then begin CPR. Place your hands on the center of the chest. Interlock your fingers and press down hard on their chest, compressing by a third. Repeat this at a rate of approximately 100 to 120 compressions per minute. Once you reach 30 compressions, blow 2 breaths that are over 1.5 seconds long directly into their mouth. Continue with the cycle of 30 compressions to giving 2 breaths until the AED arrives. Open the lid of the Mediana A16 AED and press the green power button. The Mediana A16 AED will automatically start the Power On self-test. The test result will be visible on the status indicator. The machine will display a circle and tell you it has passed.
Unit OK.
Or display a cross and tell you it has failed.
Unit failed.
The battery status indicator in the same area will let you know if the device is charged or not. The pads are pre-connected, but if for some reason they're not, the unit will tell you to
plug in pads. Insert connector firmly.
Once this is done correctly, the unit will tell you to
remove clothes from the patient's chest.
Make sure to also remove anything that may contain metal, like jewelry and bras, as metal can conduct electricity and can cause burns. Remove the foil packet on the pads and select the option for adult on the front of the unit. Pediatric and adult pads are the same for this device. You will be instructed to
place pad exactly as shown in the picture. Press pads firmly to patient's bare chest.
If the person has a lot of chest hair, you may need to shave them. The unit may have an accessory prep kit, which includes a razor. Using the pictures as a guide, for adults, place the green pad under the right collarbone and the red pad beside the left nipple, just on the ribs below the heart. If the person is 1 to 8 years old or weighs less than 25 kilograms, press the switch to pediatric mode and apply the green pad to the chest and the red pad to the back. Make sure the sticky pads have a good connection to the skin. Once the pads have been applied correctly, the machine will say,
do not touch the patient. Analyzing and charging.
If a shock is required, the unit will say,
shock advised.
The unit will say,
shock will be delivered. Do not touch the patient.
It will then count down.
3, 2, 1.
The unit will tell you when there has been a
shock delivered
and when it is
safe to touch the patient.
You can now
begin CPR.
The unit will sound a metronome for you to keep rhythm to. Stay with the patient until the paramedics arrive. Congratulations! You now know how to save someone's life with a Mediana A16 AED.